Hi there. It's 7 p.m. in state controlled Britain, and I've got with me the UK, no, the world's top nutritionist, Richard Smith. Hi, Richard.
Stephen, good day, kind sir.
Good day. So this week I had criticism that we get straight into the questions and we don't linger and say goodbye. It's all a bit, hi there, Lee Copus in the room. It's all a bit rushed. Now, when we do this, when we have a little bit of a to and fro, people moan that we don't get enough time for all the questions, so we can't win. So we try our best, I promise you. Now, the guest is not in the room at the moment. We're just hoping that Dr. Anthony Chaffee will appear. There may be some hold up at his end. So we're going to dive straight into the questions. Thank you to anyone that does a super chat. That is always appreciated. And we will get into the questions. So super chats move you ahead. I don't know if you do a super chat with a question, whether that is for Anthony Chaffee or not. So we'll do one that isn't a super chat first off, and then we'll get into the super chats. Right. So Lifespanners is saying, I am a 52-year-old woman, ex-vegan. I am on HRT for perimenopause, estrogen, progesterone, testosterone cream. My symptoms prior were terrible and now all gone since starting. Any thoughts? 100% carnivore.
Yes. Keep doing what you're doing. So yeah, it makes perfect sense because what many people don't realize is that all estrogen was once testosterone. And if we look at what makes testosterone, it comes from cholesterol. So cholesterol will, through a series of steps, will convert into pregnenolone, progesterone, and then androstenedione, testosterone, and then estrogen. So by default, when living an animal-based lifestyle and consuming more of the natural fats and the cholesterol found within these animal proteins, it makes sense that we upregulate this pathway, which is one of the main reasons that some of the world's most famous carnivores have quit becoming carnivore is because their testosterone has tanked on carnivore. And they believe this to be low carb. But if we follow the process back from cholesterol through the several processes in regards to the lanosterol, all the way through to where are we? Was it desmestrol, lanosterol, squalene, and then we're into mevalonate, HMG-CoA, and then the input into that is acetyl-CoA, which builds up during ketogenesis because of gluconeogenesis. So basically, we need to create glucose when we are keto and carnivore. So the citric acid cycle stops spinning because it uses the oxaloacetate within to create glucose via gluconeogenesis. Acetyl-CoA builds up and enters HMG-CoA, and then this goes on to create cholesterol, which eventually, as I say, through those steps creates testosterone and then estrogen. So it makes perfect sense. It makes perfect sense that when we consume the foods that nature intended, that all of the body's natural functions begin to work efficiently. But what it doesn't, the sense that doesn't make is, I'm not going to drop names, but many carnivores within the space have said that their testosterone has tanked, but it can't be to do with low carbohydrate consumption, because again, that whole pathway is based on acetyl-CoA, which we can make via carbohydrate, but ultimately it's cholesterol that allows us to create testosterone and estrogen. But the reason for this is that it becomes more efficient because testosterone is used, again, in men and women. Testosterone is used in glycolysis, so the creation of energy via glucose, which if we're not utilizing, the requirement for that amount of testosterone is lower. Testosterone is also used to create red blood cells. And we know from the reticulocyte test that live in a carnivore lifestyle, the red blood cells live longer. Therefore, that lowers the requirement for as much testosterone. And it's also used in lipolysis and the beta oxidation of stored body fat. When we live a ketogenic and carnivore-based lifestyle for a prolonged period of time, our body fat percentage becomes lower, and most of our energy from the fat comes from dietary fat and not stored body fat. And in order to do that process, in order to break down stored body fat via lipolysis, that also involves testosterone. So there are at least 3 pathways within the body that we know are testosterone reliant, which we no longer require that amount of testosterone. So if we live the lifestyle, then the amount of testosterone to carry out said work becomes lower. But it makes perfect sense for everything within the body to work more efficiently, because everything becomes more sensitive, everything becomes upregulated, and it's not being pulled away for other work. So yeah, fantastic news. Keep up the incredible work and keep doing what you're doing.
That's brilliant. I think we've got Miguel with a super chat. Let me just get that up on the screen. Thank you very much for that. Show that there. Okay, so my ANA-IFA came back positive. So that's an anti-nuclear antibody, indirect fluorescent antibody. That's actually what it stands for. Came back positive. Also, ANA pattern came back nuclear dense fine speckled, which is actually quite common if you haven't got anything in particular, by the way. Rheumatoid factor 17H. Will fasting reset autoimmune system? Also, would the carnivore diet resolve my autoimmune system, and why?
Yeah,
well, they're great questions, aren't they?
Yeah, is a brilliant question. So look, if we look at autoimmune comes from intestinal permeability. So leaky gut, essentially. What causes leaky gut? Well, there are a number of contributing factors. Alcohol causes leaky gut. Prescription drugs cause leaky gut. Other drugs will cause leaky gut. But from the nutritional world, or lack of nutritional world, should we say, grains are one of the biggest contributing factors in the form of wheat germ agglutinin. And we're all familiar with gluten, but grains contain a protein called wheat germ agglutinin, which binds to the enterocytes on the epithelial cells lining the gut, causes the release of a molecule called zonulin. When zonulin is released, this causes a gap in the tight junction between the epithelial cells, which means that undigested proteins travel into the bloodstream where they shouldn't be, and they bind to other cells within the body and create havoc. And this is essentially what autoimmune disease is. So autoimmune disease comes from intestinal permeability. So when we gravitate towards living a ketogenic and carnivore-based lifestyle, even at the first thing that I will say to people in regards to making better health choices, rule number 1 for me is drop the grains. Remove the grains completely. Whether you are low carb, keto, or other, removal of the grains is going to see a big improvement in all health and well-being. And being one of the main contributing factors to autoimmune, this is where you're going to see the biggest lever pulling. Grains are also high in carbohydrate. So by default, we tend to gravitate more, even if we're eating more veg, we tend to gravitate towards vegetables then that are slightly less or lower in carbohydrates. So removal of the grain is always the first port of call for me. Grains are not what they once were, and one of the most detrimental compounds, I believe, on the planet. But doing that is going to allow you to heal the gut. Now, how much is going to prevent your gut from healing? Well, it's about this much each day. So less than 1 bite of a piece of bread. So when people say, oh, everything in moderation, no, not at all. This much will prevent your gut from healing. So it needs to be complete removal of the grains.
Yeah. And just so you know, nuclear dense fine speckled doesn't always mean that you have something. Actually, it can be seen in people without any clear symptoms, and also if you're actually healthy sometimes. So and the rheumatoid factor 17H doesn't necessarily mean you have arthritis. It could just be immune mediated joint inflammation. So, but we're not doctors. That's just basically because I did blood testing for a decade. So
just one other thing to jump onto this as well. If arthritic pains are of a concern, obviously the biggest thing, as I say, we can remove are the grains, but anything that is high in oxalate also needs to go. So we need to remove things like turmeric. We need to remove spinach, kale, for example. All of these will cause havoc and give arthritic type symptoms. And yes, turmeric is not your friend. Turmeric can seem to be beneficial in the short term. I won't bore you guys with this unless the conversation goes this way later on with the questions. But there is a reason why it works in the short term and then causes detrimental health problems further down the line.
Brilliant. Thank you very much. Okay, let's move on. No sign of Dr. Chaffee yet, although I know we're live on his channel at the moment. So hopefully we will see Anthony himself. Leo Lyon, thank you very much for the $6.99 super chat. What is the optimal blood pressure for a middle-aged man? There is your question. Well, what we used to say, because I'm old, I'm 60, so let's get into what we used to say was okay, and it seemed to work for everybody, is you take your age and you add 100. So my blood pressure, the top number, the systolic would be 160, then take 40 away from that, and that should be your systolic 120, and that seemed to work fine, absolutely fine. When you get consortiums getting together and then resetting these blood pressure limits, they can get it really wrong. So they've continually brought it down and down and down, which of course brings more people into the remit of having blood pressure medications. And it went below 120/80 quite a few years ago. I do have a Substack all about this with all the history and who made the decisions. And I think they took it down to, anyway, they took it below 180/20. I don't want to say the wrong information, but it was definitely below that. And then there was lots of anecdotal people being dizzy and fainting and all this sort of stuff because the blood pressure was actually too low. The next meeting of the committee, they increased the blood pressure recommendations back up. And in the document, they said, but this has nothing to do with anecdotal remarks about people being dizzy. I think they were lying. So 120/80 is what the insurance companies want you to be at, and that's what the mainstream medicine people want you to be at. So, but if you look into it, there's a lot more to blood pressure than just those numbers. I know, Richard, you want to speak on this as well, I would imagine.
Look, I think you've nailed it. I think you nailed it. Look, it's how do you feel is what I bounce back to, because there are lots of people that I know who have high blood pressure, low blood pressure, and they are incredibly fit and healthy. We shouldn't be driven by the numbers per se if we're feeling fantastic. I think blood tests, blood pressure, all of these metrics are fantastic if we have a problem and we're trying to find the root to that problem, but we shouldn't try to find a problem.
Yeah, absolutely. And I know people say, well, it's a silent killer. It isn't about how you look and feel. But normally, actually, it is about how you look and feel. And that was definitely in the old literature as well. So that's it's not medical advice. It's just information for you to go down a rabbit hole and have a look at if you want to. Right. The next question is from Val M. Thank you very much again for the super chat. Do you have an opinion on GLPs and carnivore? With Diane. So I don't know what that means, but anyway, do you have an opinion on GLPs, which of course are glucagon-like peptides, which I think are hot in the news?
Yeah, I'm not a fan. I'm not a fan of GLPs. I'm not a fan of metformin. I'm not a fan of most drugs. I'm not anti-medication, by the way. But GLPs, they alter the way that the body works naturally. They affect the speed in which the food passes through the body. And I think that there are better ways in order to address the issues that we find, from the health side. It's, yeah, I'm not a big fan.
No, I'm not a big fan. And we have in the house, backstage, we have Dr. Anthony Chaffee. He's just putting on his makeup and his team's doing his hair for him. The lights going on. That's great. And we'll put him on the stage now. Looking fabulous. Hello, Anthony.
Hey, guys. Sorry about that. I had to sort some things out first.
No worries.
That's okay.
How you doing, man?
Yeah, I'm good. How are you guys?
Good. All good?
Yeah,
All
very good.
Yeah,
It's nice to see you.
Yeah, nice to see you guys too.
Well, you've come in at a really nice moment to answer Val's question. Do you have an opinion on GLPs and carnivore?
I don't like them. I don't like them at the dosage that they give them for weight loss. It is a useful diabetes medication at diabetic doses, and at super high weight loss doses, I think they can be very problematic. Also, I don't think they're really needed all that much when you're on a proper diet. I think it's one of those things. It's like bariatric surgery where it just forces you to stop eating as much, and that's and that's how you lose weight. It also makes you just feel sick and miserable, and it causes gastroparesis and paralyzes the stomach, so you physically can't eat a lot. That's like a gastric sleeve. It's just like a medical gastric sleeve. It physically limits you from eating, but it doesn't tell you how to eat or what to eat. And so on the other side of it, when that nausea stops, and if the gastroparesis ever ends or you come off the medication, now you've got even worse eating habits because you've been eating just hot garbage the entire time, because you just need something high kick energy, or you just can only eat a little bit of, so you're just eating bits of candy all day. I know a lot of people like that. And yes, they do lose weight because they're starving themselves. Anybody can starve themselves into a lower, dress size. Everybody knows that. Happened in Auschwitz and every other concentration camp out there. So you can do that, but is that healthy long term? Is that going to be beneficial to you long term? Now, if you're on carnivore and you actually do have proper eating habits, you probably won't get as many of the deleterious side effects, such as when you lose weight, 90%, people typically regain about 90% of the weight that they have lost after they stop. So it's not a net gain of all that much. But the really big thing is, it's hidden, is that you lose weight, but you're not trying to lose weight. And you look at the commercials, it always helps you lose weight. It doesn't say anything about fat. And 40% of that weight that you lose is lean body mass. It's probably because you're eating a shit diet. And so when you regain the weight, you're getting 90%, but it's 100% fat. You're not gaining any of that lean body mass back. And it's, that you really can't afford to lose 20, 30, 40 kilos of lean body mass, especially if someone's elderly. That's lean body mass that they're going to have to struggle to get back. So if you're doing just carnivore, I've basically seen this be superfluous. I have patients that they've gone on carnivore, they were losing weight steadily, but they really wanted to lose it faster. One lady had a vacation. She had a target in mind. She wanted to lose this weight for that thing. But she was losing 3 kilos, which is 7-8 pounds a month every month. It was just like clockwork. It was just coming down, and her leptin was coming down, her insulin resistance was coming down. All these markers are improving, and her weight is improving. And she just waited another 6 months, she would have been at her target goal. She wanted to do it a bit quicker than that. And so she had a prescription for Ozempic from another doctor, and she took it. And what do you know? It was still 3 kilos, 3 kilos, 3 kilos, 3 kilos. It didn't actually change the weight loss whatsoever. It actually was the same trajectory, because her body was already limiting the amount of food that she was eating, and kept her in the right metabolic state. I have seen doctors use much lower doses, so not the weight loss doses, but more like the diabetes, or lower, like sort of microdosing and stuff, for sort of the hedonistic cravings, right? So like sugar and carb cravings, where people are having trouble sticking to a diet conversion like carnivore. They can have low doses of this that sort of cut away those cravings, and that it's easier for them to stick onto a carnivore diet, or a new way of eating, and things like that. As long as you have those in combination and you're not using those massive high doses, I can see the utility. I don't use them personally, because I have a more intensive coaching program, and sort of more hand holding. It takes more of my time, but I think it's a better outcome long term, and we can avoid using these drugs that can be potentially very harmful to people, especially at those doses.
Brilliant. Thank you for that. Life spanners. We've just been talking about blood pressure before you got on, Anthony, and this is one of the things that people need to worry less about. My blood pressure has always been low, 90/60. Is having low blood pressure a problem, as it is high blood pressure? Should I be trying to raise it? And you need to ask things like, are there any symptoms? Are you feeling dizzy, lightheaded? Those sort of things. What would you say?
Exactly. I mean, if that's normal for you, and that's physiological, then yeah, that's fine. But blood pressure that is too low, as in not physiological, not normal for you, and you are symptomatic, is absolutely dangerous, and can be as dangerous as high blood pressure, but in very different ways. You can get dizzy, lightheaded, you can pass out, you can hit your head. If it gets too low, you're in hypovolemic shock or something like that, you can't perfuse your tissues properly, then that can be very serious. It can be life-threatening. funny anecdote. When we first figured out blood pressure during World War I, World War II, I forget exactly where it came in. It was during wartime. A lot of medical advances happened during wartime out of necessity. And so they were looking at blood pressure, and basically when people had been bleeding a lot and losing a lot of blood, the blood pressure is going to go low, and that was associated strongly with death. And so they were tracking blood pressure basically to see, is this guy going to bleed out? Do we need to move fluids? We need to bolster up his blood pressure. And higher blood pressure was, oh, good, thank God, it's higher. Okay, he's not going to die. It was the lower blood pressure guys were all the ones dying because of that hypovolemic shock. And so when was it Truman? I think it was Truman, President Truman, who was World War II president. The day before he died, there was a log in his medical notes by his doctor, and president of the United States, so this is one of the top doctors. And he said, I'm very happy with the president and how he's doing. I think his heart is beating very strong. So I'm confident that he's going to survive and do really well, because his heart is really strong. His blood pressure is over 300. So it's really working hard. So I'm not worried about how strong his heart is. Dead the next day. So, obviously our understanding of this can change, but yeah, if that's just been your normal blood pressure, you're not symptomatic, then I wouldn't worry about it. But yes, low blood pressure, lower than your physiological standard, is a problem.
Yeah, Richard, did you want to add?
Spot on. Nothing to add.
Okay, right, that's fine. Never seen him so quiet.
Yeah, look, I can't spend 20 minutes on a question when we've got Chaffee in the room also, because he likes to spend 20 minutes too, and I think we'll probably be here until, well, God knows when.
Okay. Wendy Vids, can a carnivore or ketogenic diet help with cerebral palsy? My friend son has cerebral palsy. Yes, that's a great question. Don't forget there are different types, by the way. It's four different types where you're looking at stiff muscles or not being able to balance. It would be handy to know what sort, but I think in general I would say, because you're lowering inflammation. But anyway, you're right. Dr. Chaffee's in the room. Let's speak to Dr. Chaffee. Sorry.
Yeah, exactly. I mean, there are different types of cerebral palsy, but the underlying issue with cerebral palsy is it's a non-progressive lesion of the brain that's stable, and it causes this neurological dysfunction, upper motor issues, or just problems with the brain if it's affecting something besides the motor region. But that can cause spasticity, that can cause other sorts of issues depending on the location of the lesion. I don't know of any studies on ketogenic diets in particular. They may have been done, but anecdotally, there are many people reporting that they are improving many of their symptoms. It's not going to cure their cerebral palsy. It's not going to take away that lesion, but it could improve, the symptoms. This is a neurologically protective diet, ketogenic diets in general, ketogenic carnivore diets in particular, because they're removing all different plant toxins that could potentially be neurotoxic or neuroinflammatory, as well as providing ketones, which are a better substrate for your brain to run on. And so we are seeing, I've had a number of people with cerebral palsy tell me personally that their spasticity is improving by going on carnivore. There's easier for them to move and to get around, better balance, all these other sorts of things. And so at least for them, they have seen improvements. It is going to be a case-by-case basis, though, to see what can be undone. But regardless of where you are at your baseline, optimal nutrition should optimize your position. It should get you to to be as good as you can be based on your particular biology, and that would go for cerebral palsy as well. And so you're going to get all the other improvements and benefits that people see on ketogenic carnivore diets as well.
Yeah, and I suppose we can flip it a bit, because we know that high carb diets, we've seen studies, it definitely exacerbates the sort of neuroinflammation. So you can sort of infer that a lower carb diet would actually not exacerbate neuroinflammation. So that's going to help, and obviously stabilizing your blood sugar should possibly be a helpful thing. Cam's dad, if you had cancer, would you take sodium bicarb?
Not necessarily. I mean, I guess if there's a need to, I mean, I don't necessarily think of that as as part of necessarily ketogenic metabolic therapy. I guess I would suppose why they're thinking about switching bicarb. I haven't particularly used that in the past anyway.
Yeah, I think when it comes to cancer, what fuels cancer, all of us have had the good Professor Seafried on our shows, an incredible gentleman who's Chaffee's just dropped out, who's gone into cancer and treatments of, and we know that all cancer cells are fueled by glucose. They are metabolically inflexible and cannot be fueled by ketones. So the first port of call for me would be to remove the fuel. They can be fueled further downstream from glutamine, but it's glucose fundamentally. The cancer cells lose their ability for oxidative phosphorylation, so it forces glucose into a process of fermentation. So the first port of call is to remove the sugar. Now, if we look at plant compounds to treat cancer, things like broccoli, we know that broccoli, particularly broccoli sprouts, have been used previously because they contain a compound called sulforaphane. Or in fact, they don't. The sulforaphane is created during the chewing process when myrosinase binds to glucoraphanin and it creates an isothiocyanate called sulforaphane, which we know kills cancer cells. But chemotherapy kills every cell in the body, not just cancer cells. So why put in a medication when we can just remove the fuel? You guys, or our regular listeners, Steve, will know that a member of my family recently died due to cancer, and it's heartbreaking when you try to help people and explain, because it's super simple. You remove the fuel, and things, depending on how bad they are, tend to improve. But it's a drug, isn't it? Sugar's a drug. It's more addictive than heroin. And the second you tell somebody that they need to remove their drug of choice, it puts the fear of God into them. So it's, In regards to the sodium bicarb per se, just remove the sugar. It's sodium is going to help if you're gravitating into a ketogenic carnivore-based lifestyle, because the sodium is going to be lost to the 4 points in the nephrons in the kidneys. So that needs to be replaced. But we've always got to get that in, haven't we?
Yep.
But let's not get too deep into electrolyte deficiency. But maybe one of the questions will pop up later in regards to that. But
okay, that's cool. Just to tell people, if you're enjoying this and you want to join Richard and myself in our school community at any point, at the end of this session at 8 o'clock, we're going to do an extra 45 minutes straight after, and you can join school. I'll put a link in the chat. This is what the school looks like. There's lots of chat going on, lots and lots of questions. We also have a classroom where there's lots of courses you can do. And you work your way through those courses, obviously. There's 9 of them. You get free ebooks, you get lots of videos, you get Richard and myself yabbering on about stuff. And also the calendar, where we got the things like Thursday, we did a special thing about gut health. And we got the 2 things going tonight. And tomorrow night, we do another hour where we do a live question and answer session, Richard and myself. So if we don't get to your question, you like how we answer it, then you can join our school, and I will put a link in the chat for you. Get back to the questions.
And also, just to jump on the back of that, Steve, Dr. Chaffee's got a private school group also.
Yes.
Cancer group. So I do a talk in there once a month. So also feel free to check that out, and we'll pop a link in the comments for that.
Excellent. So get back to school, everyone. Right. If you don't, give you detention for not turning up. Right. Okay. Here we go. What is the optimal? I really hate the term. What is the optimal level on carnivore of B12? I'm currently 406. Wow. Well, if you're living to a 406, that's amazing. I tell you, you must be absolutely vital.
Accomplishment. Yeah.
I'm assuming that you're in the US, and you're probably talking in picograms per millimeter.
Well, he's pounds, so
it's pounds.
Possibly UK.
Sorry?
The currency. The currency is pounds, so it might be in the UK.
Ah, wow. Okay. Well, that's very high. Okay. Well, you're probably carnivore if it's very high. This is one of the things, actually, I'm going to be speaking to, actually, I can't mention this, but anyway, on Tuesday, we're actually looking at optimal ranges for the carnivore diet, because normative ranges for you know, for blood tests are based on people eating 45 to 65% carbohydrates, and rarely are they metabolically healthy. So it's more about how you look and feel, how you're sleeping, anxiety levels, your muscle mass, all of those things. So I would say they are the most important things. I wouldn't aim for a number, but I'm quite happy to be told differently if you feel differently.
I know Dr. Chaffee is going to jump in with something now, but we've had this conversation before, haven't we, in regards to the difference between the numbers in the UK and the US. So I think the US test for B12 total, and I think it's active in the UK because ours is a lot lower, so roughly a third, I think, isn't it? But you take it away, Dr. Chaffee. I know that this is something you're incredibly well versed in.
So active B12 is very different than total B12. Typically, when they report it as total B12. And the reference ranges are always very different. And so, but there's just the units difference from the US to the UK, or there's a significant percentage difference. So, if you're looking at like 800 picomoles per liter, which is like the UK number, that equates to 1100 picograms per milliliter in the US. So it's actually a big shift. So there's a big difference there. But if you look at the research done at Oxford in picomoles per liter, it's published in 2008, they had a study looking specifically at B12, and they were not deficient, quote unquote, because they call it deficiency below 150 picomoles per liter. So none of these people were deficient. Below 308 picomoles per liter, to be exact. And below that, they did MRIs every year. And after 5 years, people below 308, their brains actually shrank by over 5%. Volume was like 5.25% brain volume loss. The reason for that being is that B12 is required for myelination of your axons. And so that makes up the bulk of your white matter, is that myelination, that increases the conductivity of your nerves and your brain cells, and makes them work properly. And so you have this sort of constant balance of breakdown and repair in your body. Your body's always trying to regenerate and renew itself to keep it young, vital, and healthy. And the same goes for your brain and your myelination. And B12 is required for DNA synthesis. So if you don't have B12, you don't have DNA synthesis. You can't turn over your new these cells and make new cells. So you get the breakdown half, but then you can't rebuild properly, and so you just get degradation of this tissue, and you can actually get demyelination of your brain, of your white matter, below a certain point. And some studies have suggested that was below 400 picomoles per liter is where you could start getting demyelination. Below 308, 5%, more than 5% of brain volume was lost in this. But in that same Oxford study, I believe it was 450 or 500, something in that range, people were still losing 2.5% of their brain volume after 5 years. So I would try to get people's B12 higher than that. And that's if we're talking about total B12, not active B12. So you're right, active B12 levels are much different. They can be much lower. So this study is looking at total B12 numbers. So you have to make sure that you're looking at total B12 or active. It should say total B12 or active B12. If it just says B12, that generally denotes just total B12 as opposed to active. So just for total B12, not active B12, because a lot of labs don't even measure up appropriately. They say it's like above 125 active B12. It's like, oh yeah, that's fine. Actually, you want a lot higher than that. But total B12, they'll keep going up. So the reference range for total B12 that I use, and it's based on different research that tries to look at what's more optimal, what's getting better homocysteine levels, etc., is between 800 and 1200 picomoles per liter. But active B12, if you can get it in high, the higher ranges, that can be more accurate. And homocysteine is even more accurate than that. You really want God, I forget the units, but anyway, below 7 is the typical sort of range for homocysteine. It can go up to 15 is often the normal reference range. Below 7, typically you're okay. So if your homocysteine is 12 or 20 or something like that, and even if your B12 is 1,000, you need more. It's just not getting to where it needs to go. But if you're sort of slightly less than that, and say it's 600, you're not quite in that optimal total B12, but your homocysteine is 4, you're probably fine. So there's more accurate ways of looking downstream, but total B12 is usually the easiest one that people get.
Yeah, and you've got the methylmalonic test as well. I'm just going to put some details in there. Yeah, great stuff.
That's the most accurate. It's just almost no one does it. So.
Okay, we have John. Dr. Chaffee, thoughts on occasional drinking as a young man on the carnivore diet, living a higher performance life, overall longevity, aging, performance, how you would approach, etc., especially with high tolerance, justifiable?
I sort of think it's even less justifiable with a high tolerance. I've always had a high tolerance. It would take me, 20 beers just to get a freaking buzz, and that pissed me off because like my liver's churning through the alcohol. I'm not getting any of the effect, but I'm getting all the downstream negative effects. Right? You're not saved from that. Right? I'm getting all the NAPK and other nasty little bastards running around my liver and body, and so I'm going to get more damage and less of the fun. So I've actually thought it was not justifiable to drink as much, which is why my personal choice as a high performance athlete was not to drink during the season. I never drank during the season up to that point that I figured it out. I basically drank as a teenager. I really enjoyed it. I was doing MMA. There wasn't really a big drinking culture there. So my trainer Matt Hume didn't drink. It wasn't that he wasn't didn't want anybody else to drink, but he just didn't, and so there wasn't that much of a culture for it. And then the rugby culture was definitely a big drinking culture. I had a lot of fun with that, as a teenager and getting snuck into bars and things like that in Canada and the US. And I was like, well, this sort of this different world. And I liked that. So I liked doing that, and I ended up going with rugby largely because of the social aspect. I really enjoyed that, that team unity sort of social aspect. Everyone hung out outside of training and games as well. So I ended up doing that. But then when I was 21, I stopped drinking for a month because I was on antibiotics. I had pneumonia, and my lungs were such that I would get, I figured just because of asthma, I would get pneumonia like 2-3 times a year, like diagnosed on X-ray, and which sucks, especially when you're trying to play sports. And I had pneumonia, and I couldn't drink for, it ended up being about a month, and I was just freaking out. I felt so weird and awkward at the bar. And then the next week I didn't feel as awkward, but it still sucked. And the next week I didn't really care. And the week after that, I was like, actually, I'm having just as much fun, and I'm not spending all this money. But my performance was next level. Even though I had pneumonia and was recovering from pneumonia, I was playing way better. I was just playing out of my skin. And the next day I didn't feel just all sore and achy and miserable, which I just thought came from the game. And then I realized, no, it's coming from the drinking, And so when I didn't drink the night after a game, I only would drink once a week. It was only after games. Just that was enough that I felt miserable for the next like 3 days, and now I didn't. I felt amazing. I'd be like, oh, I could just do it again. I could just keep going, and then the next week I felt better and better and better. So my performance went next level when I put down the booze, and so that was my choice. I never drank during the season. I never drank during training or anything like that. It ended up being once a year or once every 2 years that I would drink, and now I don't even know the last time I had a drink. It's probably about 3 years ago now. I just would rather have my body work better and just feel amazing all the time. I have noticed that the rare occasions I do drink, and I'm not having beers, I'm not having wine, I'm not getting all the tannins and all the other things, glyphosate and beers and things like that. It's just I'm just getting clear liquors like vodka sodas, like that's it. So even then, just sort of trying to isolate the alcohol part of that and not get all the rest of the crap. I don't feel hungover the next day. I just feel a bit more tired and lethargic. And I noticed that my workouts are affected negatively for 3 to 4 weeks after that. I can't work out to the same degree. I can't push myself well with the same ease that I normally would. I do a quarter of the workout that I normally do, and I just feel like crap. I'm like, "Oh, I'm done. I gotta go." And then next week I could do a bit more and a bit more, but it really took 4 weeks before I could get back into actually doing the standard of workouts that I was used to. And so to me, something would have to be worth losing a month of optimal health and how I felt and performance for me to justify drinking. And that, not surprisingly, doesn't come up all that often.
Brilliant. Thanks for the answer. Okay, everybody, if you don't like swearing, you might not like the next question. So you can turn the volume down or be ready for this. Okay. What are your thoughts on Lane Norton saying high LDL is a problem with the carnivore diet?
Well, the thing is that I mean, this is just the old paradigm, the old way of thinking, is that LDL is bad, but that's changing, and now we're not looking at total LDL or total cholesterol. We're looking at HDL and triglycerides. We're looking at insulin resistance. We're looking at metabolic dysfunction. That's that's not coming from me. That's coming from Dr. Eric, people like Professor Eric Westman of Duke University. When I was doing my sub-internship, it was at Duke. It was in plastics reconstructive maxillofacial surgery. Amazing hospital. It was the number 4 hospital in America at the time, and they're generally in the top 5. So this is not to appeal to authority, but Eric Westman is not an idiot, and he's been using this for 25 years in clinical practice. And he has had patients with so-called elevated LDL and total cholesterol for 25 years, and he's not seeing any problems. And so that's fitting the studies that are showing that LDL is not the problem. New research is coming out now, like lean mass hyperresponders. It is specifically in that cohort of people on a ketogenic, high meat, high fat diet, like a carnivore diet, and they have absolutely no progression in atherosclerosis past normal baseline that you would see in a healthy population, aka the Miami heart cohort. So it was 0.8% progression per year, and that's normal. That is not elevated. And a lot of people actually had no progression or even reduction in their atherosclerosis, 6%. So 6 out of 100, there was 100 patients or people in this study actually reduced their atherosclerotic burden, right? And we're certainly seeing that anecdotally. So no, you actually can't say that LDL is a problem on a carnivore diet. In fact, we can explicitly say that it's not, because we have the studies to show that, showing that people with LDL over 500, that they don't have an increased progression of their atherosclerosis. So they found no association, no correlation whatsoever between plaque progression and LDL or ApoB, which is like the other sort of boogeyman that they're throwing out there, which is just shifting the goalpost. First they said cholesterol generally, then they said, oh, okay, well, there's a shitload of cholesterol. What are we talking about here? Okay, LDL, that's the bad cholesterol, and then that didn't quite work. Okay, SD-LDL, okay. And then that's not really a strong predictor either, not certainly as much as metabolic syndrome and diabetes. And they're like, oh, ApoB. I was like, Jesus Christ, it's not cholesterol. All right.
Yes.
Like, it's just not cholesterol, and you can see warning signs in your cholesterol, like your HDL is low and your triglycerides are high. You have high SD-LDL, something like that. That can be a warning sign that something else is going on, but that's not the same thing as saying that is causing the disease, that is causing the atherosclerosis. It's the smoke, it's not the fire. And either way, the only way you get elevated SD-LDL and low HDL and high triglycerides is when you're not eating properly anyway, or you're in a high stress state, not sleeping properly, cortisol issues, you're on medications that can cause these sorts of things. But either way, in a normal physiological state, eating a normal human diet with high fat, ketogenic diet, that does not lower HDL and raise triglycerides. It does the opposite of that. And so, it's just the old way of thinking. And it's, there's a weight of inertia behind that way of thinking. So, I understand why people have that, but it is the old paradigm, and it does not predict heart disease like we have been told that it does.
Brilliant. Thank you for your answer. And it's very unusual to see the words Lane Norton and thoughts next to each other, because they don't go together. And just to plug, I'm speaking.
They're our thoughts on Lane Norton.
They're our thoughts. That's true. Yes. I've got Dave Feldman coming in a couple of days, and we're going to be going through the study that he did with Nick Norwitz and others. And
and the thing is, I really like that Dave has done this and has put this out there, because it's about time we put the nail in the coffin. Because the fact of the matter is LDL was never proven to cause cardiovascular disease ever. The only studies they ever had were very weak correlative studies. And like the 7 Nation study, which we know was flawed. It should have been the 22 Nation study. But either way, let's say it was done perfectly, and it wasn't. He didn't go in there during Lent and completely try to like misrepresent like what they were eating and things like that. Let's just say that everything was on the up and up. It can only, observational studies can only show correlation and not causation. It's only hypothesis generating. It cannot be hypothesis proving. You cannot prove a cause and effect relationship from these things. And that's all that was. And the randomized controlled trials that Ansel Keys of the 7 Nation study did, called the Minnesota Coronary Experiment, where there's a double-blind placebo study that had people eating just normal food and then replacing animal fats with vegetable oils and butter with margarine. They found that doing that intervention did indeed lower LDL cholesterol, but more people died of heart attacks and strokes as a result, in a linear dose-dependent relationship. And so he buried that, and that didn't get uncovered for 40 years, and have the whole study published until 2014 at BMJ with Professor Dr. Was it Ramsden who uncovered that. And so that's purely dishonest. But we based this entire premise on observational studies that were very flawed. Now let's look back at the 7 Nation study. People can argue on why the 22 total nations weren't used for that, but it comes down to a very simple fact that people omit and don't necessarily even know about, that I saw pointed out by a doctor at the University of Washington who did a presentation on this at UW Medical School, which is the #1 medical school in America, by the way. People think it's Harvard. Harvard's the #1 research institution, medical research institution in America. UW is the #1 for training doctors and GPs. And they go back and forth with Johns Hopkins for 1 and 2. And UW is actually the #6 research institution. So, at least when I looked at it, when I was going through. And so they're one of the only medical schools in America. They're both in the top 10 for both medical training, education, and research. Harvard is not. So UW is a very good school. They train very good doctors. And this was a lady there giving a presentation, and she pointed out that even though Ansel Keys, his conclusion for the 7 Nation study was, and he said this, he's like, well, look, maybe cholesterol causes heart disease, maybe it doesn't, but it's not that big of a deal to just take it out. You're not going to be hurt by taking it out, but you need those calories from fat replaced by something else. So just replace them with sugar. Just good old sugar. It's just an empty calorie, and so you can replace it with that safely. Well, we know he was being paid by the sugar company, so that makes that recommendation very suspect. What makes it even more suspect is that he, in the 7 Nation study that he used to justify replacing fat with sugar specifically, the relative risk increase in just those 7s that he cherry picked to show that parabolic increase in cardiovascular disease, the increased relative risk association, it's called an R value. That R value was like 0.84 or something like that for cholesterol and heart disease. Sugar was identical, had an identical R value, increased relative risk association, that he found for cardiovascular disease. And he then said, well, because of this scary R value for cholesterol, you should just go over and switch to sugar. Same goddamn R value. So this is dishonesty. Yes. Gary Tao is a much better man than I. He's much less cynical, and he thinks, he's like, no, I think that he was being sincere and honest. He was just gripped in this paradigm, and he just had to sort of lock onto it, and he just couldn't see what was in front of him, and so he just got lost in his confirmation bias. I think he was intentionally doing this because
I do as well.
Because he threw away the Minnesota Coronary Experiment, but not only that, the R value for cholesterol and published R value in that study was the same for cholesterol as it was for sugar, and his conclusion was, don't eat fat, eat sugar instead. So it's unfortunate, but there has never ever been hard evidence showing that LDL or ApoB or any other cholesterol particulate causes atherosclerosis. So I think that it's great that Dave Feldman and Nick and everybody, and Adrian Sotomoto and everybody are doing this sort of stuff, because it it sort of brings this to national attention. But when you realize that it has never been proven in the first place, and now we're being asked to prove a negative, it's just sort of ridiculous. And I'd say, like, no, hold on a second, you never proved this in the first place. Well, everyone knows, and they said, no, that is not evidence. That is not proof. You have to have actual hard experimental data to show proof. This is like, and so now we're trying to, they've asserted that there is a magic spaghetti monster that's influencing the tides, hiding behind the sun, and you can't observe it. And we are supposed to prove that it doesn't exist. So you have to prove it exists first. We don't have to prove that negative. And I think if we start changing that discussion paradigm before, we have to prove that cholesterol is not a problem. Cholesterol was never proven to be a problem in the first place. And so I reject that paradigm and just be like, get on with my life.
100%. I can see Steve stress in there, because there are a few other.
There's loads of questions. It's a big topic, right? So we're going to do a little whistle stop of just thanking people for super chats. Dory, thank you so much for your super chat. We're going to do that, and then we'll get to the super chats that have questions attached. Jim, thank you very much for your super chat. And then you're right, actually, I was stressing. Lucas, I think, PLN 10. I don't know what that is, actually, what that currency is. Right, now let's get to some questions. And we will try to get to them all, but Richard and I disappear at 8 o'clock because we got to go to the ball. And we turn into a pumpkin. Right, so Jari, I think that is, diagnosed with motor neuron disease in November 2024. Sorry to hear that. Affecting my right arm, forearm, and voice. Tried a carnivore diet, but struggled with frequent cheating due to cravings. Have you seen similar cases? And how long did it take for voice and mobility to return?
Let me jump straight on this one really quickly, and then Dr. Chaffee, you can jump in. Look, it's carnivore is going to be the biggest lever you can pull with this, but one of the main, or two of the main contributing factors, coffee needs to go whether you're carnivore or not. Coffee contains a compound called acrylamide, it's a potent neurotoxin, which is going to massively exacerbate this. So whether you're carnivore or not, you need to remove coffee and caffeine, two potent neurotoxins. I know this firsthand, because the acrylamide started to cause issues with me. When cooking your meat, try to cook them for longer, slower, on a lower heat, rather than flash frying or even barbecue, because the acrolein within the meat can cause an increase in acrylamide in meats also. So in regards to the cheating, look, this is an entire different episode, but it's to do with the neurotransmitter production. It's to do with balancing glutamate and GABA, and to do with allowing the body to fuel and create dopamine and serotonin naturally. The downside when we consume plant compounds is that we block this process, because many of the plant compounds, lectins and phytates, will block many of the cofactors involved with the creation of the neurotransmitters. So tryptophan, tyrosine, and phenylalanine, our aromatic amino acids, go on to create our neurotransmitters. And the cofactors involved, zinc, iron, magnesium, B3, B9, B12, so on and so forth, they can be blocked by as much as 100% when we co-consume a quality animal source, full nutrient-dense animal protein, full of vitamins and minerals, with something that contains lectins and phytic acid and other plant compounds. So living the lifestyle is going to allow you to combat this the best. Things you can do to combat also the cravings is increasing something called CCK, cholecystokinin. We increase this with saturated fats and amino acids. Therefore, living the lifestyle and understanding and having faith in the knowledge of living the lifestyle being the best thing to combat this will enable you to do that. Stimulating melanocyte stimulating hormone, so getting out into the sun when the sun is lowest in the sky, early in the day or late in the evening, will increase melanocyte stimulating hormone, and increasing our body's ability to recognize cravings and to combat cravings. We can also increase by omega-3s and saturated fats and amino acids. So again, just have faith in the knowledge that living the lifestyle, consuming lots of quality animal proteins, high in natural fats, is going to allow you to do this. But when you get cravings, eat more omega-3s, eat more saturated fats. You can also take glutamine as a supplement. This will also help blunt the sugar cravings, but it's not a magic fix. Just my 2 pence really quickly.
Yeah, I mean, so we don't have studies on motor neuron disease with this or with many things that can help, but there are more and more people going to ketogenic carnivore diets to try this anyway. At least they're having some sort of benefits early on. Now, that's just the benefits that everybody gets, and just sort of improving where you are, or is it actually slowing the progression of the motor neuron disease? Remains to be seen. That's going to take more time and really experimental data sets to really be able to say that clearly. But I think it's definitely something that helps neurological diseases in general, and you're providing all of the nutrients that your brain requires. The choline, creatine, carnitine, DHA, EPA, cholesterol. All these different sorts of things that your brain, B12, D3, all these things that your brain absolutely requires for normal functioning, and even just maintenance for somebody without motor neuron disease. When you have motor neuron disease, you really need to make sure that this is optimized. Motor neuron disease, people don't know what's causing it, but some people theorize that it could be an autoimmune disorder. If it is, then carnivore is probably your best friend, because I think that carnivore addresses the underlying root cause of autoimmunity. And I have a lecture that I'll be giving at a medical conference this year discussing that and going over that. But it's not just me. I mean, there's papers going back to 1991 where medical doctors are arguing that autoimmune diseases, and it goes through the mechanisms for all these different autoimmune diseases, that this phenomenon is better explained by the negative impact that plant lectins have on the body. And so, and that when you just specifically discuss things like multiple sclerosis, or there's damaging the white matter in the brain, he thought that was much more likely than the body just freaked out and starts attacking itself like an infection, which I don't think is happening at all. And I go into that in that lecture. So you need to do 2 things. You need to get rid of all these things that can be potentially neurotoxic, even coffee and caffeine, sorry to say, and just be very clean, just meat and water. You're also going to get rid of all these other plant toxins that can be highly harmful to your brain. More of the plant omega-6s like linoleic acid can be neuroinflammatory also, and you want to get rid of these sorts of things. And so, eating proper food, being in ketosis, so your brain, 2/3 of your brain optimally run on ketones when they're available. We know that it's a preference because when you have ketones, but you also have an abundance of glucose, that 2/3 of your brain will exclusively run on the ketones. So that's a preference. That is the primary energy source. That is how definitions like that are ascertained. And it also reduces inflammation, neuroinflammation. So I think that I have a protocol for multiple sclerosis that is sort of how to optimize these things. And what I think of, getting proper sunlight, getting proper food, getting your B12 and vitamin D and other sorts of things in proper levels, maybe even supplementing with, choline, creatine, other sorts of things. Specifically, just, you're going to get a lot of these things from the meat that you're eating, but, just make sure you have an abundance of these things so you don't have a bottleneck there. That those are just things that can optimize your health. I have it specifically for multiple sclerosis, but I have it on there. It says this applies to basically any neurological issue, and I would recommend doing the same things for motor neuron disease as I would for that MS, and that's on my my Twitter, my X pages has that on there.
That's brilliant. Now then, Richard and I will be over at school in a couple of minutes. So thank you to everybody that's put a question forward. Thank you, Anthony Chaffee, for coming along and answering some of the questions. For those people that have done a super chat and a question, I've taken screenshots. So Richard and I will go through them at some point, and we'll put a video out answering the questions that you've put there, because it would have been nice to get to them. But the other thing is, we like to give full answers. So sometimes an hour isn't long enough. So maybe we need to do another 24-hour live stream, just us 3. But anyway, I want to thank you, everybody, for the support. Certainly all the YouTubers. If you join us over in school, that'd be great. But Anthony, did you enjoy coming on?
Yeah, definitely. Always do, man. Yeah, it's always a pleasure. And sorry for being so long-winded. I guess we'll call it thorough.
100%. 100%.
Yes. Yeah, it's been an absolute pleasure, and it's always nice to see you. If we did a 24-hour live stream, do you think you'd show up? Do you think you'd want to come on?
Yeah, I'll always try to do that, guys. Yeah, definitely.
Yeah. There you go, Richard. That's our first one that we've put under pressure in front of people. Right, Anthony, thank you so much.
Yeah, no problem. Thank you, guys. Good to see you.
Thank you,
there's a link in the chat to the school if you want to come over and see the next 45 minutes.